This is awesome. My freaking alarms keep going off. So sorry for the 3-part YouTube. This is probably super annoying and confusing. So that's all I got, though. Thanks, folks. But I think my other proposal for society to help women, by the way, I'm doing these videos so I can procrastinate charting. I hate charting. I just want to talk to people. That's all I want to do. So I'm just going to work with my ADHD on this and just let it happen. But the other thing is, if we, my vision of a radically different society is that we just put a disclaimer nobody has to not get plastic surgery or not put a filter on. Have fun with it. Get creative with your body. Use your money how you want to. I'm not trying to police anybody. But maybe there's always a disclaimer of this person has had these surgeries, or they at least they've had, not an outing them with a HIPAA violation, but if we could all just be open about what we've been doing, or this other person who, next to you, your 55-year-old friend who's lost weight and you can't lose weight for the life of you, and she's not disclosing that she's been on high dose GLP for years. That's psychologically distressing, because you think you'll blame yourself and be like, well, she did it naturally. How come I can't do it without cheating? I hear that a lot. Medications are cheating. No, they're not. But we don't get awards for not using weight loss medications. I'm just saying, no one is handing out medals to be like, good job, you're trying to lose weight without a medication and it's not working, and you get a medal for not cheating with the GLP, right? That doesn't happen. Yeah, I have no problem prescribing Kickstarters, right? I honestly look at the Ozempics, the Zepbounds as psych treatments. They're psych treatments because of how distressing the weight piece is for midlife women. And people are like, oh, don't take it from diabetics. And I get that. I have my best friend's really diabetic and I love her so much. And she's, on a rare occasion, have a hard time accessing her injection med. And I desperately want her and everyone else in her same boat to get what they need. But there's enough to go around. At this point, there's enough to go around of these medications. And I'm not sponsored to say this. It's just the amount of psychological relief I've seen in my practice from women using those, in addition to lifestyle stuff that we talk about, it's psychologically better. And why not use a psych med if you're depressed or anxious about something, right? So that's how I think of it. But in the ideal society, there would be less pressure to manage weight, but manage belly fat, to use a GLP to get there, to be traumatized by how fast and dramatically the body changes in midlife. That's the vision I have for our world. I don't know if we're going to get there, but I think as more women are talking about menopause, I think there's some women who are telling their daughters, and that's going to help. And I'm just putting this on social media, so that's one little teeny drop in the bucket that maybe can help someone. And I know, so I've had midsection weight gain. I'm struggling with it myself. This doesn't feel like my body, and this is not how I've always pictured myself. I'm thicker, and that it's an adjustment. And I know that's not the worst part yet. There's going to be a lot more to come, because I'm not above 50 yet, right? And I'm on HRT. I take estrogen, a high dose, because I had symptoms early. Like a lot of women do. It starts in your 30s for some folks. The pre-menopause, as I call it, treats you better than birth control. And I don't get paid to say that. Not literally. I have a job in the field, but I get paid nothing extra to give anyone hormones. It's a whole passion of mine, because it's just so great to help people go from suicidal to I love my life over and over and over and over and over again. I love my job because of that. And that's what getting an estrogen patch will do. And if the distress is still there with the weight, maybe adding a med if someone asks for it. But yeah, that's my little rant about midlife, the most distressing piece of it, and my vision for a beautiful world also is that healthcare providers understand how important this is for women and how really upsetting the weight gain piece is, and to really listen to women. And if you're in a system where you only have 5 minutes and you need to talk to this lady, talk to your patient about her blood pressure, and you don't have time to address weight, it can at least be as simple as affirming her and saying, I hear you. I know this is distressing. I've heard, even if you've not been in menopause yourself, doctor or nurse, like if you just acknowledge, like, I know this is a serious problem for you, that this needs to be treated, that this needs to be taken seriously, and we can do that. Right now, we do need to talk about your blood pressure, but let's figure out a time when we can actually focus on that, because I want you to feel at home in your body. Like, if every doctor and nurse practitioner and prescriber, health provider could say something like that, it takes maybe 10 seconds and it's not going to stress women out. But I just have so many patients who say they bring it up with their primary or their local doctor, and they feel really way further upset because that person will often say, you're just getting older. And it's like, what? You kidding me? That's it? That's it? At least affirm the patient, right? That's medicine number one. Affirmation is medicine. So I'm calling all providers and practitioners to hopefully get there if you're not already there. It takes a few seconds. If you don't want to prescribe weight meds, you don't want to talk about weight with those patients because you don't know enough about it or it stresses you out, you don't have time, fine. At least we can affirm our patients and be like, yes, this is a problem. Somebody should have warned you. And maybe we can even warn our patients who are not anywhere close to premenopause and just say, hey, there's something that's coming. I want you to know, no matter what you do, it's going to happen. And it has nothing to do with you not trying hard enough. It's not a moral failure, but there's going to be a midsection weight gain that's going to happen. I don't know when. It could be in your 40s, your 50s, but it's coming and it's not your fault. And if you ever need to talk about it, I'm here. Like something like that, education for our patients ahead of time. And I think that's a sensitive, difficult thing because women who are not in that place in their life, the younger women, truly have no idea how real it is. And how can you if you haven't been through it and it's not a common societal conversation? So I think it could be challenging to bring up to some patients, especially I know I'm a body positive, affirming person that tries to really support people and just feeling good in their body. I don't care what the scale says. Like, how do you feel about yourself? How do you want to feel? And this is a really distressing thing. Like, I used to hate bringing up weight as a provider, as a doctor, nurse practitioner. We're trained to always talk to people about weight and force it down their throats. And if you lose weight, you'll have better blood pressure, your cholesterol, lose weight. And that's messed so many people up. I've always not had that conversation because it's not my place to ask someone about their weight. Like, they can bring it up to me, right? And man, have I flipped after working in menopause. I still don't initiate it, but it comes up every time. I don't have to initiate it. And it ranges from women that are close to skinny women who make me nervous if they would lose weight. It happens to them. They may still have a low body mass index, but they have more belly fat. And it's the same for someone a really high body mass index. So it's like the level of distress. It doesn't matter where you start from. I think it's just that sudden, unexpected piece and where it shows up and the societal standards and being gaslight by former providers. It's this storm of severe psychological distress that women are undergoing. And it's across the board in America. At least the states I see people in multiple states. So that's my sample size. And of course, it's not everyone. And I am a biased sample size because people are coming to my clinic because they know they're going to get care that's targeted to their midlife concerns. So it's a biased sample, but it's significant. So that's my rant for now. Hopefully we change some things in society and learn how to accept normal so we're not as distressed when this happens, and we can support the the distressed person and maybe give some advanced guidance to people who haven't encountered it yet.